If you've been considering a career in dentistry and you want to become a dentist, an orthodontist, an oral surgeon, or anything else in the dental field, and you've been thinking what it takes to go through dental school and get to that point, this video is going to be for you, because in this video, I'm going to cover what it takes to go through the path of becoming a dentist and what that roller coaster all the way through dental school is like, based on my own experience of going through the journey of becoming a dentist and the 4 years of dental school, which I completed at UCLA School of Dentistry. You'll get the behind the scenes look at what it's like, the responsibilities, the challenges, all the different things that you have to go through to get the DDS or DMD behind your name. So whether you're a future dentist or just curious about the dental world and what it takes, this is your all access pass to what the path to dentistry is like. If you're new here, I'm Dr. Andrew. I'm a dentist who has served on the advisory board for the dental school application, and I'm really passionate about mentoring pre-dentals to help you get accepted into dental school. So we'll start with the first year of dental school, which is the most daunting year and really the biggest transition as you go from college to dental school, but also probably the most fun year because you're making your lifelong friends while everyone's going through this new and honestly pretty tough journey. It's a hard time, but it builds a lot of camaraderie between all of you guys. So the first year is all about laying the foundation. It's like building a strong base for a skyscraper. In your first year, you'll be introduced to the basics of dentistry. You'll attend lectures, get hands-on with your dental handpiece in labs to learn about the anatomy of the mouth and dental materials and all the fundamentals about oral health. It's a lot of groundwork as you take on a lot of lecture courses covering things like biochemistry, cell biology, physiology, and anatomy, and even anatomy lab, dissecting cadavers and working with them to really understand everything there is about anatomy. But it's also a very crucial year where you'll get a lot of hands-on experience with everything from tooth waxing to drilling plastic teeth and getting to really mimic and stimulate that actual dental experience. And to compare the course load of undergrad, college with dental school, looking back on my dental school transcript, I was enrolled in about 10 to 13 courses per semester or quarter, since we were on a quarter system, but that compares to about 3 or 4 courses that you're typically gonna be enrolled in just undergrad. So dental school is really heavy with both lectures and lab courses. And for all those courses you will be taking in dental school, I found them to be just as difficult and really much more difficult than any of the courses I took in undergrad. And looking back on my dental school transcript, we were in courses like dental anatomy, learning about anatomy of every single tooth, like different cusps and ridges. We were in morphology and inclusion, which were courses both revolving around a lecture component and a lab component. I was in 2 basic science courses, which were essentially like a combination of cellular biology, physiology, and biochemistry. I was also in an oral hygiene course, gross anatomy with the cadaver lab, which was the most difficult course for my first quarter. And then there were also a few courses focused on ethics, dental principles, and just doctoring. While taking about 10 courses seems like the most you'll be able to handle, things actually ramp up during your second year, and you'll likely be in even more courses and more difficult courses during your second year, which is known to be really the most notoriously difficult year in dental school. And before going on to the second year of dental school, I want to really emphasize that during that first year of dental school and really during the first few weeks, you really want to focus in on honing your study skills and your time management skills, because those are also going to be the foundation for your success during the rest of dental school. So going on to the second year of dental school, things get a lot more intense. In your second year, you begin focusing both more on preclinical lab courses, where you're drilling crowns, fillings, and getting hands-on with practicing more complex things like root canals as well, but you're also diving way deeper into lecture-heavy courses. During my second year at UCLA School of Dentistry, I was enrolled in about 12 to 13 courses at a time, and they're tough and demanding. I was in these courses for about 25 hours each week, and then I had about 9 hours of time for clinic to actually see patients and treat them, which was really just doing things like cleanings in our second year. So between the clinic and our courses, that was about 35 hours of schoolwork. And then on top of that, there was of course time that you need to study for those 10, 12, 13 courses that you're in. And if I didn't already make the point, these are really tough courses, but also courses that are super relevant to the practice of dentistry. So they were courses like oral pathology, clinical periodontics, endodontics, complete dentures, and courses about the development of your face and teeth from the time you are born until the time you are an adult. As we go into covering the third year of dental school, if you're finding this video helpful, please give it a like and subscribe for more pre-dental and dental school related videos. So during your third year of dental school, things start to get really fun with clinicals, which is also a time when things start to pay off because now you're in the clinic and you're actually being the clinician. So it's a lot of putting your didactic knowledge and the practice in the sim lab or preclinical lab to use, which is really what you signed up for. It's the actual dentisting part of dental school and being a dentist. It's all the clinical and hands-on aspect of dentistry. For the first time in your life, you're probably going to not only be actually providing the hands-on care to the patients, putting your handpiece or drill to tooth, but also managing patients on a social and personal level. It can be a little nerve-wracking to do your first few restorative or endodontic procedures like fillings, crowns, and root canals on patients during this time. By this time, you've also done these procedures in that sim lab on a mannequin with those simulated teeth countless of times under rigorous grading and strenuous conditions. During your third year of dental school, you'll also be doing rotations through the different specialty clinics like oral surgery, periodontics, pediatric dentistry, and you may even go on off-campus clinical rotations where you really sit in the driver's seat, being the dentist and treating patients outside of the school's clinic. The third year is also when most dental students take the Integrated National Board Dental Examination, known as the INBDE, which is essentially the first major exam for getting your dental license. It's about 12 hours of testing time with about 500 questions, and you take the exam over the course of 2 separate days, since it's not really realistic to take an exam for 12 hours straight. At the end of your third year, you'll also be applying for specialty programs if you're interested in specializing. So this can be a really exciting time. And by this time, you'll also want letters of recommendation and clinical experience covered for your residency application. The application process for residency and specializing is pretty similar to the dental school application with a few differences like match. And it's also something that my team and I help dental students with, as you'll need to complete things like your personal statement, select the right programs to apply to based on their requirements, put together a CV, and other things that are similar to the dental school application. Most interviews for specialty programs are conducted throughout the fall of your fourth year, and considering most specialty programs only have a few spots, it's a lot more difficult to receive an interview for residency program than it is for dental school. Everyone gets their results of whether they matched into a specialty program or not and the name of the school on the same day in October or November, depending on what specialty you're trying to match into, or a few months later in January, again, depending on the specialty you're pursuing. Going into the fourth year of dental school, in my mind, this is the best year and the most fun year. You'll have a lot more time to do things and enjoy your life outside of dental school for the first time in a few years, since your evenings will usually be free after you see patients, instead of spending your nights and evenings studying for your didactic courses and exams, since those are pretty much all out of the way once you're into your fourth year. The fourth year is when pretty much all of your time is spent seeing and treating patients and starting to get much faster and better at the different procedures that you're doing. If you haven't already done them, this fourth year is also when you'll likely be doing your off-campus clinical rotations, practicing dentistry in different offices. This is also when you take the AADSAS or REB, which is the clinical portion of your licensing exam, along with another 100 question exam where you're tested on your actual procedural skills. The clinical portion of your licensing exam is done over 2 days, where you complete procedures like root canals, crowns, and a bridge, as well as different types of fillings, which are under really heavy scrutiny. Even a deviation of 0.5 millimeter can be the difference between passing or failing your board exam. And that's because dentistry is super technique specific and precise. And if you're interested in how much it costs to attend dental school, you'll want to check out this next video where I go over that.